In this section, we're going to talk about male hypogonadism, which is a clinical syndrome leading to not enough testosterone or not enough sperm. Now, as we know, testosterone is produced by the testicles, which gets converted into either estrogen via aromatase or dihydrotestosterone via 5-alpha reductase. Each of these hormones then has their own effects, including estrogen, which leads to breast growth and development of muscle, fat, and bone, as well as dihydrotestosterone, which leads to increase in hair growth, increase in prostate growth, and development of sexual secondary characteristics. Testosterone has these same effects as estrogen on bone, muscle, and fat, as well as on dihydrotestosterone on secondary sexual characteristics. It also has its own effects on development of the voice box and development of red blood cell production. These three hormones stimulate sperm production as well as drive sexual behavior or libido. They in turn feed back at the level of the pituitary gland, which, in response to the levels of these three hormones, will secrete hormones FSH and LH, which in turn will stimulate the testicles to produce more testosterone and more sperm, keeping the levels in balance and the patient healthy. For proper case detection and not screening, patients in whom you suspect low levels of testosterone need to have their levels checked using a reliable assay at 8 a.m., as this is the time when levels are typically at their peak. Once morning low testosterone levels have been confirmed, the next step is to check FSH and LH to determine the level of defect. An elevated FSH and LH indicates that the patient has failure of testicular function, possibly from an infection, prior surgery, drugs, or autoimmunity. However, decreased or inappropriately normal levels of FSH and LH indicates that there is a failure of pituitary or hypothalamic production of FSH and LH necessary to stimulate testosterone production from the testicles normally.